extrahepatic biliary apparatus. The liver has got its own excretory mechanism. Mainly, the bile is considered as the excreta of liver. Okay, so if you refer to some old anatomy textbooks, you'll see that the excretory apparatus instead of extrahepatic biliary apparatus, you may see it as excretory apparatus of liver. Okay, so as of now, we'll see only the extrahepatic biliary apparatus. Okay. So when we say extrahepatic, which means it is outside the liver. Okay. Biliary meaning the pathway of bile. Okay. How the bile is moving outside the liver. Okay. That is what is known as extrahepatic biliary apparatus. So when we say extrahepatic, there must be a intrahepatic part also. Of course, the intrahepatic part is much of a cellular kind of structure. So let's not discuss in this chapter because it's part of the histology. Okay, and it consists of intracellular bile passage, bile canaliculi, and bile ductules. That is what forms the intrahepatic biliary apparatus. And the extrahepatic biliary apparatus is formed by these structures: right and left hepatic ducts. These two ducts will join to form a common hepatic duct. Okay. Then the common hepatic duct is actually passing downwards for about 3 centimeters and joined on its right side and at an acute angle by the cystic duct. Okay. So the cystic duct is the one which is coming out of the gallbladder. Okay. And after the cystic duct is joined to the common hepatic duct, both will continue further as bile duct. So let's see, in detail about gallbladder. Okay, the gallbladder. The gallbladder is said to be a kind of purplish or a kind of bluish color. Okay, and it is a piriform shaped sac which is contained in the fossa for gallbladder, which is present in the inferior surface of the liver. I hope you remember the inferior surface of liver. Okay. Uh, in This is a small introduction about the gallbladder. Okay. In invertebrates, the gallbladder is a small organ where bile is stored before it is released into the small intestine. Humans can live without a gallbladder. Of course, you might have heard that some of your family members might have gone through this surgery called as cholecystectomy. Okay, where the gallbladder is removed from the person's body because it might have got infected or there might be a stone present inside the gallbladder. Okay, and the gallbladder is also known as cholecyst or biliary vesicle. Let's see in detail about the gallbladder now. It is located just beneath the right lobe of the liver. I hope if you remember the inferior surface relations of the liver, you might have remember you can remember the fossa of a gallbladder where the peritoneum covering is not present. It is pear shaped or piriform shaped. Both are correct. Okay, and the normal capacity is around 50 ml. It can store up to 50 ml of bile. Okay, and the length is around 8 centimeters and breadth is around 4 centimeters. Let's see the parts of gallbladder. Okay, the gallbladder has got fundus. You can see a large part, that is the fundus, bulged part, the end portion. Okay, and next is the body. This is the elongated body part. Okay, and then it has got a neck which is curved almost. Okay, and the neck will terminate in a narrow infundibulum. You can see this particular narrow part is known as infundibulum here. Okay, and then it is continuing further as the cystic duct. You can see the cystic duct is joining to the common hepatic duct. Okay, then both together further named as common bile duct or simple bile duct. And you can see further the bile duct is joining with the pancreatic duct, and these two will form the ampulla of Vater here and then open into the second part of duodenum. You can remember the chapter of duodenum here. Okay, and before, you can see here, the right and left, hepatic ducts, they are joined to form the common hepatic duct. Okay, so right and left hepatic duct join to form the common hepatic duct, and the common hepatic duct joins with the cystic duct to form the bile duct. Okay, common bile duct. Let's see about the fundus of gallbladder. The fundus of gallbladder is rounded end that faces the front of the body. Okay, you can see when you hold the liver in anatomical position, you can see the fundus of the gallbladder being popped out in the inferior border of the liver. Okay, you can really, I think I might have explained about the Murphy's sign when a patient is suffering with cholecystitis. Okay, the fundus may be inflamed, or the inflamed gallbladder will be touching the peritoneum. Okay, whenever he breathes in or breathes out, the inflamed fundus will touch the peritoneum, so that it will create a sudden shocking kind of pain for the patients. It is surrounded by peritoneum only, all the sides. Okay, it is surrounded by peritoneum all the sides. Okay, and it has got some relations here. Anteriorly, it is the anterior abdominal wall. Okay, posteriorly, beginning of the transverse colon. Beginning of the transverse colon means the ascending colon is taking a bend, isn't it? That is the hepatic flexure. We call it as hepatic flexure because it is related to the inferior surface of the liver, isn't it? So once the hepatic flexure is over and then transverse colon is beginning, that part is related with the fundus of gallbladder in its posterior aspect. Let's see about the body of the gallbladder. So this body of the gallbladder is actually present in the fossa of a gallbladder, okay, in the liver, which is present in the inferior surface of the liver. Posterior aspect is there is no peritoneum, meaning the posterior aspect here is the part which is actually covered with the, or the, present in the fossa of a gallbladder, and inferiorly it is covered with the peritoneum. The inferior aspect means which is actually facing downwards. Okay, that is actually covered with the peritoneum, and the transverse colon is actually related completely with this particular body part. And also you can see the second part of duodenum is related to body of gallbladder. So in this picture you can see here, this is the body part of the gallbladder. Of course it is opened here. Okay, and just you can see here, the inferior aspect here. Okay, it is related to the second part of the duodenum. This is the duodenum actually. Of course the transverse colon is removed here. Okay, only the duodenum can be seen here. So this part is related to the body of the gallbladder. Moving on to the neck of the gallbladder. It is the narrow upper end of the gallbladder, tapers and continuous with the cystic duct. Okay, the neck is continuing with the cystic duct. There is a constriction at the junction with the cystic duct. Okay, so this constriction will help gallstones which are formed not to pass through this particular cystic duct. That is the importance of this particular constriction here. Okay, and also it acts as a sphincter to release the bile whenever is needed, or the stored bile. Inferiorly, it is related to the first part of the duodenum, and the posterior medial wall presents a small pouch called as Hartmann's pouch, where usually the gallstones will get stuck. Okay, you can see here, this is you can see the first part of duodenum is removed here. If the first part of duodenum was here, you can imagine that it is related to the neck of the you can see here, this is the first part of duodenum like this. Okay, so this particular part is related to the neck of the gallbladder here. Okay, this is the neck of the gallbladder. Of course the Hartmann's pouch is not in this picture, but you can see in the next picture. Okay, here you can see, let me remove this. Okay, yeah. So here you can see this is actually the cystic duct which is coming out, okay, and to join the bile duct here, okay. So this part is the, this elongated part is the Hartmann's pouch. Here you can see in this picture, okay, this is the Hartmann's pouch, this one. Okay, so now we'll see the blood supply of gallbladder, okay. The blood supply is mainly by the cystic artery, which is branch of the right hepatic artery, okay. Cystic artery is a branch of right hepatic artery, and the right hepatic artery is of course the branch of common hepatic artery, which is a branch of the celiac trunk. And the venous drainage is by the cystic vein, and the cystic vein of course ends in the portal vein, okay. Coming to the lymphatic drainage, they terminate at celiac group of lymph nodes. That's all you need to remember, okay. Other information is not required for you here, okay. The nerve supply is, it's having both sympathetic and parasympathetic from the celiac plexus, okay. Of course the parasympathetic is always with the help of vagus nerve here, okay. And it's believed that it secretes a hormone called cholecystokinin, which is dumped into the duodenum.